Pull this privacy curtain. Hey there. My name's Tony. I'm going to be your student nurse today. I'm going to wash my hands quick. Could you please tell me your name and date of birth? Okay. Take a look at your wristband and see that that matches. Can you tell me if you have any drug allergies? No allergies at all? Okay, good. What I'm here to do today is do a some suction on your tracheostomy. So, the first thing that I'm going to do is make this bed a better working height for me, not to strain my back. I'm going to place you in the semi-Fowler's position. Good. I'm going to do a quick respiratory assessment. I also want to verbalize that I have a extra tracheostomy kit available as a backup if needed. And the next thing I'm going to do is put on my face shield and mask combination. The next thing I'm going to do is turn the suction up on the wall to between 80 and 120 millimeters of mercury. If younger patients, that's going to be less. So next thing I want to do is open my kit here away from me in a sterile fashion. First thing I'll grab is the cup, the paper cup. I'm going to open that without touching the inside. Set that aside. Going to pour some saline into that. That is not expired. Filling it up to about 1/3 full. Next thing I'm going to do is put on my sterile gloves. That's okay. Flip that around. Actually going to open these up right here. It's a separate pack in my kit. Doing this using sterile technique. So, next thing I'm going to do is get my suction catheter out of here. I'm going to use my dominant hand, I'm right-handed, to gather up the catheter. Now I'm going to make my non-dominant hand unsterile now because I'm going to turn the oxygen on to hyperoxygenate the patient before I do the trach suction. So this hand's now unsterile. I'm going to use this hand to grab the suction tubing off of the wall and connect it to the Y port here. So while the patient's hyperoxygenating, I'm going to take the trach suction. I'm going to test it out in the saline to make sure that's working using the Y port, and it is. Let the saline clear out of there. And now with my non-dominant unsterile hand, I'm going to take the oxygen mask off the patient and begin trach suction. I'm going to insert it into the tracheostomy while not applying suction. I'm going to insert it until the patient gives you a good cough, or if it's about 4 to 5 inches, it would be less for a pediatric or younger patient, or until you feel resistance. If you do feel resistance, you want to pull out just a little bit, maybe a ½ inch before applying suction. Then using the Y port, you're going to intermittently apply suction while removing the catheter. You want to do this over a max of 10 to 15 seconds, keeping everything sterile that is sterile. You want to clear it out with some saline, but before you do that, you want to put the mask back on, the oxygen mask back onto the patient so they can re-oxygenate after you suction. And then you would clear your tubing or your suction with the saline. Then, if you needed to clear more secretions, if they had some real thick or a lot of secretions, you could continue these steps, but in between, you need to let the patient re-oxygenate for at least 1 minute in between. So, in this case, everything was good. After just one, he didn't have many secretions, so I would be done with this. You can place things there. I would gather up my trash, take off my gloves, wash my hands again after taking off gloves, turn the wall suction off. I would put the bed back in this scenario. I know it's odd, but I'd put it back down. I would give him his call light, make sure his guardrail was up, make sure he doesn't need anything else, and then I'm going to verbalize the need to perform oral care every 2 minutes. I'm going to do another respiratory assessment. I'm going to then go out and chart. I'm going to chart the procedure I did. I'm going to chart his secretions, the color, the odor, the consistency, and the amount. I'm going to chart how the patient did during the procedure, and then I'm going to chart any adverse reactions or abnormal findings. And then if the patient doesn't need anything else, you can make sure they're safe, got the call light, rails up, beds down, and then go and chart.